Welcome to Your Healthiest Life, a Blue KC Health Education series. What an incredible panel we have to talk about the youth mental health crisis, which the U.S. Surgeon General calls the defining public health crisis of our time. Let's first introduce you to Dr. Stephanie Schreiber, licensed psychologist at Children's Mercy, Kansas City. And Dr. Schreiber, why are we in a youth mental health crisis?
There's a lot of things that have kind of brought us to this mental health crisis that we're in. Just thinking about general development of children, there's some natural psychological and emotional things that change over time as we lean in and transition to preteen and teen and adulthood. But on top of that, there are so many things going on in our world. And these things date pre-pandemic. So we know the pandemic has been a big factor that has kind of led to, exacerbating some of these challenges. But even before that, social media is a huge area that we're really focused on and learning more about and trying to figure out what research supports, what are the benefits versus the cons of all of the social media things that are going on. Just our general political environment right now is another stressor. So when we think pandemic specifically exacerbating those changes, kids had crazy disruptions to their everyday routines. School, they were home on virtual, trying to connect with teachers through a screen and students. Social isolation was a big one. Even just family challenges that they were going through. So if they had a family member who lost a job at home, if they were exposed to any type of abuse in the home while they were spending more time at home, all of those things have really contributed over the last, I would say, 10 to 15 years towards this mental health crisis that we're in.
Well, great to have with us Dr. Diana Elke-Shawi, math teacher at Center High School in Kansas City, Missouri. And I know you're a big believer in supporting the mental well-being of your students through daily check-ins. Mm-hmm. Why is that something you do? And what are you seeing the unique challenges and behavior from students that's making this a youth mental health crisis?
So our values at Center School District are for students to succeed. And in order for them to succeed, we have to have that safe environment for them to thrive in. And that, with that being said, that also helps build that community within our classrooms and our school district. Those daily check-ins, I would say, they're not a waste of time. Just to make sure that I acknowledge each student by name and see how they're feeling that day. It could be something that someone said in the hallway. It could be that simple. And it just threw them off balance. And now they're not ready to learn. One of my favorite things that I always like to remember as a teacher is Maslow before Bloom. If the kids do not feel safe, if the kids do not feel like they belong in a classroom, and that won't help their self-esteem, obviously, in the way they feel. So in return, that's going to make them shut down. And then I cannot teach them anything. So taking those, 5 minutes at the beginning of every class and making that a routine to check in with each and every student, how are you feeling today, is important. I don't think it's a waste of time. It helps build those relationships as well. The pandemic, social media, everything is so fast-paced in today's world, in their world growing up, just trying to keep up with everything. It's tough. It's tough being a teenager and being a kid right now. So it's important to let them know that there is an adult that cares and will take the time. And if they're not okay, we have the resources.
So now that we've talked about the problem, what work is being done locally to address the youth mental health crisis? Let's bring in Kristen Gernon, Blue KC Behavioral Health Program Manager. And I know here at Blue KC, Kristen, we are so proud of a new partnership we have with Children's Mercy Kansas City and the Center School District to tackle the youth mental health crisis.
You're right. We are so proud and so excited about this new pilot initiative. It's a 3-year pilot program that is being developed in partnership with Children's Mercy and Center School District. It's exciting for a lot of reasons because we're looking at not just targeting individual students, but targeting the whole school district, targeting the supports that are needed from for staff and students alike, and even families as an extension of the school and part of building the school community and strengthening that school community. Has several components, and we're at the early stages. It just launched in January 2024, so we're in the earliest stages of implementation, but there's a behavioral health consultation team that's embedded in the school district that's really looking at what's working, what areas and opportunities are there to better collaborate and better pull in all the resources that already exist to be most effective, and as well as implementation of restorative practices. A very, very exciting initiative that's focused in on improving communication and problem solving and conflict resolution by strengthening and repairing those relationships when those get fractured due to conflict and due to different kinds of behavioral challenges and that occur naturally in a school environment. Restore Ed is our partner in implementing this foundational work that's really creating, it's not a training, it's more of an intervention that targets the whole school environment. It's making sure everybody's walking the same direction and talking the same talk and using the same skills to resolve conflict. And it's really focused in on improving communication and relationships among those in the school, especially teachers and staff members to students. We know that if kids have a caring adult who's really looking out for them and is really engaged with them, kids are going to be more successful in school and have overall better outcomes for their own mental well-being as well.
Well, Dr. Elkishawy, you're one of the teachers receiving the support and training to help your students' behavioral health, mental well-being, and it's starting with the teachers. What about this approach and how restorative practices can make a difference?
I really believe in it. I'm very passionate about it because I've seen it work. My biggest takeaway from the training that we've had so far is that when the student recognizes that I'm behaving this way, they take ownership over and accountability over, the behavior they're having in the classroom, and then change will happen because they answered certain questions that led them to see their own behavior from a different kind of perspective. Then they're able to change it.
And I just remember you saying you're tired of sending kids to the principal.
Yes.
Or sending them suspension. So
Yes.
maybe you could give us an example of how you would use restorative practices in your class. And I really think anyone watching this video can benefit from.
There is a student, it was a couple of years ago, she had her head down and she didn't want to do any work. And instead of, repeatedly just telling her, put your head up, do work, or I'm going to send you to the principal's office, or that's it, I've had it with you. I went over there and quietly talked to her and I told her, are you feeling okay today? And she said, no, I have a really bad headache. And I said, okay, then what can I do to help? Because I just care about you and I don't want you to fall behind on the work that we're doing, but first we need to take care of you. So she's like, let me go to the nurse and see if I can take some, ibuprofen. So I sent her to the nurse and she was gone for about 5 minutes and she came back. She felt better. She felt like I care about her and she felt like I want to include her in what we're doing in the classroom. And she said, is it okay if I sit on that bench that has comfortable pillows? And I said, of course, as long as you have what you need to get your work done. So I feel like sometimes what we say and do with students can either make them want to be in the classroom or make them just dread being in the classroom. So I think it's very, very important to understand why the behavior is happening. Because students sometimes act out because they're not okay, whether it's something from outside of school or inside of school that happen. Sometimes students act out because they're academically falling behind, but yet that usually can also be traced to behavior. But we work together as a community to help them, and that's when they can succeed and feel like they belong.
Well, Dr. Schreiber, you're part of this collaboration and you're there to help. You're leading the Children's Mercy Behavioral Health Consultation Team. What does this team do?
So we really have been collaborating with the district to hear all about what is going on in Center School District. We've tried to meet people where they are, so we've attended family events like soccer games to hear from parents. We have created a advisory council composed of different members of each school. We've done a lot of different things just to gather information, to listen, to learn, to take that second, which I think is what has made us stand apart from other programs or partnerships that other districts have had, or even Center itself, because we're listening. We want to know, hey, where can we fit in at? What are the needs of the district? We don't want to just prescribe something that is just like a one-size-fits-all approach. We know that that's not what works, and especially not what works in schools. We are now leaning into kind of launching our actual health consultation team, which is informed from that needs assessment. And what we found was kind of this big buzzword we've been using called implementation fatigue. Teachers are tired. There's a lot going on in the district. There are a lot of programs and frameworks and resources that are unbelievable, honestly, like how many people in the community and other people are engaged with the district. But they don't have a great plan, or they kind of all exist in these silos. So it's really hard to know, how can we help these students best, or are they getting the services that they need, or how can we kind of streamline these things that make sense to help prevent any of these challenges from arising, and that we have good ways to respond to them when they do happen. And so the behavioral health consultation team is going to start at the system level. We're going to help try to streamline all of those different programs and practices, create a really strong prevention system that all students will get, help kind of tailor all of those like academic, social, emotional, and behavioral supports all into one. We know, kind of as we've kind of been chatting about, can't really just treat one, they all intertwine in some way. And so our main goal is to first tackle that system, help strengthen all of the things that are in place, make sure we're using those most evidence-based supports. And then we are going to move after that into kind of some more targeted supports for more specific behavioral programming and practices. But our main goal is to build capacity of the district. So we want teachers to feel supported, to be able to do these things on their own, to feel empowered and educated on all of these practices, so that when this time comes, it's not like, oh, I feel really uncomfortable, what do I do next? That they just know, like it kind of becomes like second nature to them of what to do and where to go and who to ask for help.
And you've mentioned it, but the importance of just a student knowing they have one caring adult in that building, which seems what restorative practices is all about. How important is that to reduce stress and anxiety?
Incredibly important, and not just for stress and anxiety, for all mental health. We have a lot of research that says school connectedness actually has really long-lasting impacts into adulthood. And kids spend most of their waking hours at school. And so those relationships are just as important as the relationships they have at home with their family and community.
Let's talk about maybe a thought from each of you on what action everyone watching this video can take.
Sure, I would encourage parents to make sure they're talking to their children's pediatrician or their primary care doctor about how their kids are doing and even how they are doing themselves, right? Checking in about how they're managing stress, how they're sleeping, how they're eating, how they're interacting with others, if they're noticing changes in mood, changes in behavior that can't be explained. We often try to compartmentalize our medical care with our primary care doctor or our behavioral health care with a behavioral health provider, but it's really important that we're talking to our primary care doctors about all of the things, right? All of the things that impact how we're functioning and how we're feeling on a day-to-day basis. So a doctor might be able to notice a red flag and say, well, that's not quite a developmental issue. That might be something more. Let's get it checked out. Let's have a specialist get involved and see if we need to do anything more than that. The second one I would mention is 988. The 988 Suicide and Crisis Lifeline is such an important tool and resource. Everyone should have that number saved in their memory. You can call it or text it or go online and chat on their website, but it's a resource not just for the crisis of suicide, but for any type of behavioral health crisis. You can call about yourself. You can call about someone else you're concerned about. It can be about substance use crises or substance use needs or any other kind of behavioral health need. But 988 is a great tool and resource that everyone should have in their pocket.
If you could think of one thing to do today, I would really recommend considering taking just a few minutes of your day each day to unplug, to build relationships and connections with your family, with your kiddos, to really have a moment to pull back from what's going on in the world today and just share, how was your day? Talk about what's going on, because that is kind of the key starting point to addressing or to kids feeling comfortable sharing about any mental health things that are coming up for them.
Just a caring conversation that doesn't have to do anything with technology, right?
Nothing.
Simple
yes.
as having a family dinner.
That's it.
Put the phones away.
I think as a classroom teacher, it's extremely important to invest the time to check in with my students on a daily basis. It will help strengthen those relationships and let the students know how much I care about them and how they're feeling that day. I think it's also an important reminder for all educators to remember that you're building that culture where you're checking in on each other. I've had students, also come in and say, "How was your day, Dr. Alkishawi?" And it's really sweet to build that kind of community. And just remember, you're not alone. We need each other. And we have that support system within our school and within our school district to give the kids what they need.
Just keep spreading all that. Those great vibes. Well, thank you so much to our amazing panelists for a thoughtful discussion on the youth behavioral health crisis. And thank you for joining us on your Healthiest Life, a Blue KC Health Education Series.